I think I took a few things away from that, and I've worked in procurement for years. But it did, for me, resonate the points around working in partnership as opposed to working in pilots. And I think that's something that's going to be a big takeaway. Now, we do have a slight rearrangement of the agenda. We're going to have 2 sponsored sessions at this stage. We're only going to have one, which is Victoria, who's the founder and MD of My Language Connection, who's going to be talking about the perfect translation and why human expertise is the gold standard in healthcare. This will be immediately followed by the session with Keith on the ROI of AI, which is going to be an excellent session to follow up on the from ambient scribing. So a slight change in agenda. Now, I think there's a couple of other things to emphasize. Please do whatever you can to attend these sponsored sessions, without whom the entire event wouldn't be possible. And secondly, we also have a really, really excellent session over the lunchtime period about medicines procurement. I'm looking forward to that one myself personally because that is a real benchmark for commercial and procurement management in the NHS. It's been a resilient model for many years, and I'm really looking forward to that session. But please do whatever you can rather than grab a sandwich and disappear for coffees to really attend that session. It's going to be excellent. And now I'm going to hand over to Victoria.
Hello, everyone. I'm Victoria. I'm the founder and CEO of a company called My Language Connection, and I'm going to be speaking to you today about using AI as an amplifier in translation and localization safely, and why human expertise is still the gold standard in healthcare. So just going to open things up just now, and I'm assuming there's a couple of reasons why folks are here and watching this talk today. So some folks are looking to come away with practical, useful use cases and examples as to how to safely use translation, use AI in translation, and some folks are coming here for some hope that the machines aren't completely taking over. The good news is human translation is still very much required to produce accurate translations, and that's what we're seeing very, very regularly. So in terms of that there, I'm Victoria, I'm the founder and managing director of My Language Connection, and our team have a combined 35 years experience within the translation sector, predominantly within the healthcare space. We've proudly helped reimagine localization workflows to support some of our clients, such as Dexcom, helping get their first human patient into clinical trials in Europe faster. We're really focused on providing high quality translation fast, and we've now developed our own proprietary software that enables us to do that on behalf of our clients. So that's a little bit about us and what I'm going to speak on today. So if the clicker will work. So what's really happening just now within the healthcare industry? So we're seeing more healthcare teams face more pressure to communicate than ever in more languages than before. But how do we make sure that with globalization moving as quickly as it is, that localization is keeping the pace in terms of supporting patient engagement in a way that information is really understood? We're seeing that almost 2% of the population in the UK right now, their first language is not English, so we have that barrier there just now. Doesn't sound like a lot, but that's around about 1.34 million people within the UK just now whose first language isn't English. In addition to that, 7.7% of the populations, their first language is not English. And we saw around about 20 billion being spent on medicines, medical device and applications last year, with around about 250 million of that going into waste and landfill. So why is that? What we're really seeing is the understanding, not just from a linguistic point of view, but also the understanding as to how to use that device safely, how to use those drugs in a way that's understood in lay terms. So how do we now use AI within healthcare to drive that content from A to B safely and in a way that's fully understood to solve some of these problems? So what's really happening and what are the real barriers to engaging with your patient groups? So a lot of you here just now are startup, scale-up businesses that have come from the NHS, that are really working to solve real life problems for patients with years of experience. Well, you know, even just the conversations that I've had this morning with businesses just now that are scaling up and starting out, it's really the macroeconomic environment, the pressures within the macroeconomic environment that we're seeing just now. So this year alone, there's been changes in legislations that have really restricted businesses' scale and growth. So it's not just how do we engage with our patients in a way that's really understood, but how do we now scale up our businesses in a sustainable way to solve some of these challenges and problems with the current restrictions to growth that small businesses are facing. And with that, in addition to that, we've got challenges around MDR, IVDR, the European Accessibility Act coming into play. So what are we hearing just now across the board? The key things that we're hearing is, how do I ensure that when I'm using AI within my translations, that my translations are safe, legal, accurate, fully understood? How do I make sure that my end-to-end localization workflows, so from content creation through to high-quality localization, and then systems integration, like are my systems compatible for Arabic, for example? That's what we're hearing. So, and can we use MT as some of this output? So right now that's resulting in longer it's resulting in delays to market and potential compliance risks and issues there. So how do we solve that problem now? So there's a balance to be had right now. So in terms of My Language Connection, we have 835 experienced medical translators that we work with regularly across our clients' projects. As I say, we've been responsible for helping some of our clients then have their first human patients into clinical trials faster in Europe, and we've been credited for innovating those workflows, providing high quality translations that have that impact fast, all the while with that system connectivity. We've built years now of content platforms, small language learning models wrapped around not just the translation aspect, but how to create your assets to ensure that they're market ready, how to then ensure that the translations and your translation assets are fully accurate and up to date. So for example, like translation memories and such like there that will recognise and understand your terminology and how to automate that side of things. Through to then system end-to-end system connectivity. The kind of key thing that we would advise looking for is a partner really that has that content base to ensure for accurate translation, but not only that, that really wraps around processes, systems, and uses AI to reduce your workflow, your localization workflow. Some of our clients that come to us, they're early stage and they're looking to move into 5 to 16 new markets, and it's completely new. So it's about that balance of then utilising on the ground lived experience, combining that with AI to produce that end-to-end workflow management that enables you to drive into markets faster. So key thing is lean on your partners, build your translation memories with repeatable content, and just, what was said before, look at your system integration, what can speak to each other to help enable you to drive that into market. That's the kind of key thing that will help solve some of those problems that I addressed earlier on in the slides. At MLC, what we've developed is, with years of research and years of client interactions, we've translated over 13 million words now globally, and we've helped our clients move into new markets to help in a range of therapeutic areas. So improving patients' lives with diabetes, helping there to improve rehabilitation after a cardiac arrest, and really how to then localise for those healthcare systems. What you should look for in a good partner there is having that end-to-end software platform that's not just a small language learning model around the translation aspect, but how are you using AI to reduce workflow, to produce that accurate translation for your patients and your end users faster. So we've developed that at MLC. And without further ado, because I know we're pretty close to lunch and people want to be heading off to fill their stomachs. So without further ado, and to close out in summary, AI can be and should be used in small language learning models as an amplifier with then identification of repetitions. It should be used within your workflow safely to eradicate any sort of repeatable tasks and steps there. We're using it in a way where we use AI, our own AI, with then integration into our CAT tools, which helps to then speed up that translation process. And you should have a good partner that helps you then redesign these workflows that you can lean on, that then solves those resource problems that I addressed earlier, in line with MDR, IVDR, and now the European Accessibility Act there. Other things that we've sort of seen over the years is then improved certificate of accuracy. So now that should have your translators' qualifications and experience from that side of things there. That's what we're sort of seeing come back from audits just now. So thank you very much. And that brings us to a close just now. I think we've got, I don't know what time that we've got. We've got time. We might have time for some questions. If not, then come see us at Stand 8, and we'll be hosting a whisky tasting later. So please feel free to come over to our stand there for a demo and some whisky. Thanks very much, and hopefully that was helpful.
Thanks very much indeed, Victoria. That was really, really, really good.